Hi, my name is Ahmed Ozigit. I'm one of the physicians here at North Cyprus IVF Center. Today, I'd like to talk to you about gender selection treatments that we offer here at North Cyprus IVF. On this slide, you can see the structure of this presentation. We're going to get started with why we offer gender selection and why people get gender selection treatment. And we're going to talk about the procedure in detail. We're going to talk about what kind of tests we require prior to treatment, and we're going to establish a timeline for your treatments, depending on whether you're having the local treatment, the initial treatments locally, or whether you come to Cyprus for the entire treatment. And you will get to meet the team at the end of this presentation. So essentially, gender selection treatment is mainly offered to patients for the purposes of family balancing. Most of the time when patients come to us, they already have one or two children of the same sex. For example, they have two female children or two male children, and they would like to have the opposite sex in terms of family balancing purposes. Because they don't want to keep trying naturally, they want to have a certain number of children. So this treatment allows them to do that. So family balancing is usually the main reason why people come to us for gender selection. But also there are certain genetic diseases that are inherited from parents. And some of these diseases may affect children differently in terms of their sex. For example, some diseases affect males more than the females, and so on and so forth. So when you select the sex of the baby, you do get to eliminate that. You do get to minimize the risk of a certain genetic disease affecting the children. And some of the genetic disorders can affect a female child's reproductive capacity or a male child's reproductive capacity. So by selecting the opposite sex, you do minimize that risk as well. So in terms of the procedure, there are two main options that we offer for gender selection. These are Microsort and PGT testing. Now, Microsort is essentially a patent technology from Genetics and IVF Institute in Fairfax, Virginia. And Microsort helps us separate the sperm sample into X and Y bearing cells. So X bearing cells are the cells of the sperm sample that help produce a female offspring. And Y-bearing cells in the sperm sample are the cells that help produce a male offspring. So with Microsort, we're able to sort the sperm sample into X and Y-bearing cells. But you should know that Microsort is not a 100% guaranteed method. It's not a 100% accurate method of selecting the sex of the child. So if you're wanting to select a male child, so if you're doing gender selection for a male child, you should know that Microsort is only able to give us an accuracy of 70 to 75%. And this in females is about 80 to 85%. So there is no guarantee that Microsort will give you the sex of the child that you want for sure, but it is a method that increases the odds of having one sex over the other. So this is usually a method just to increase the odds. Microsort can be coupled with an IUI cycle or an IVF cycle. When you opt for an IUI treatment, this is essentially one of the least invasive methods of sex selection. It is the only non-invasive method of sex selection. So this is predominantly why couples usually opt for this, because it doesn't require so much medication. It doesn't require anesthesia. So it's a very, very easily planned cycle. And the female patient receives a very mild medication protocol during an IUI cycle, but because we still need to mildly stimulate the ovaries and time the treatment. So once the follicles reach a certain size, we administer a trigger injection so that we can precisely time the timing of ovulation. And after a specific time, after the trigger injection, the sorted sperm sample, the sample of the sperm that has been microsorted, is injected into the uterus. So by injecting the sperm sample into the uterus, we bring the sperm cells in the proximity of the ovulated egg. So in a way, this gives us a higher chance of success, a higher chance of pregnancy compared to natural conception. So we're essentially bypassing the whole female reproductive tract, and we're putting the sperm sample closer to where the eggs are situated. So but essentially we're still letting nature take its course. So in terms of the likely outcomes of an IUI cycle, the chance of success is not going to be great, because IUI is still a procedure that lets nature take its course. Even though we bring the sperm sample in close proximity with the egg, the fertilization is still not done by us. So it is still up to the sperm cell to go and fertilize the egg. So depending on the age, the success rates will differ, but overall we can say that we do expect a 25 to 30% chance of success in a given IUI cycle. So what this means is, even though you might be fertile, even though you may have no problems conceiving naturally, success with IUI would still be limited to 25 to 30% on average. So the younger the patient is, the higher the success rate will be, but it may take multiple cycles of IUI to get pregnancy. In terms of gender accuracy, if you do get pregnant, so you are in the 25 to 30% group that gets pregnant, then the sex of the child, if you are wanting a male child, then you're looking at a 75% chance that your child will be male. And you're looking at about 85% chance of having a female child. So as I mentioned before, Microsort is not a 100% accurate method of sex selection. It just increases the odds. And the cost of Microsort IUI treatment currently is set at 2,800 euros. One other option, which is something that gives you a bit of the higher chance of success in terms of pregnancy, is Microsort IVF treatment. In this treatment type, the female patient is still prepared via medication regimen, but in this case, we're stimulating the ovaries with a bit more medication, because our purpose is to be able to obtain multiple follicles. We want as many follicles as we can get, so that we can get as many embryos as we like, so that we can transfer the best embryos into the uterus at the end of the procedure. And what we do is we screen the follicular growth via multiple ultrasound scans, and once the follicles reach a certain size, we administer a trigger injection. After the trigger injection, instead of injecting the sperm into the uterus just as we would in an IUI cycle, in this case, in an IVF cycle, we actually collect the eggs from the patient's ovaries. So we collect the eggs, we process them, and then we can use the sorted sample to one by one inject every single oocyte, every single egg that we collect, so that we don't let nature take its course. We actually create the embryos ourselves in the laboratory environment. Once we create these embryos, we incubate them for about 5 days until they reach the blastocyst stage. At this stage, depending on how many embryos you have and how many you would like transferred, we can select the best performing embryos and transfer them into the uterus. So comparing this to an IUI cycle, you can see that the chance of success with a Microsort IVF treatment is much, much higher. Especially if the patient is young, the patient's age 35 and below, the chance of success could go as high as 70-75%. So this is the chance that you will get pregnant. And as the age goes up, obviously, this will go down because as the female age goes up, the quality and the quantity of eggs that we'll be able to obtain will also go down. So the chances of success will start going down. In terms of gender accuracy, again, because we're relying on Microsort only, the gender accuracy will still be similar to Microsort IUI. So there's a higher chance that you'll get pregnant with Microsort IVF treatment, but in terms of gender accuracy, we're still looking at about the same rates. The cost of this treatment is 3,900 euros. So again, with Microsort IVF, you're looking at a higher chance of success in terms of pregnancy, but in terms of gender accuracy, it will still be similar. And this is the main method. PGD is the main method of gender selection if you do want an accurate gender selection testing. So this is actually a genetic testing procedure where a small biopsy sample is taken from each embryo. So this is obviously a part of an IVF cycle. So once we go through the IVF cycle, collect the eggs, create the embryos, then we incubate these embryos into the blastocyst stage. And then a very small, tiny biopsy sample is taken from each and every embryo. Then these biopsy samples are subjected to genetic testing and genetic screening. And with this genetic screening, you can either go for a 5-chromosome testing. So if your only purpose is to select the sex of the baby, the 5-chromosome testing is usually sufficient. So we're testing X, Y, 13, 18, and 21, which are responsible for the sex, as well as certain major genetic disorders such as Down syndrome. So for example, if you're concerned about the risk of having a baby with certain genetic disorders and you want to be able to select the sex of the baby, the 5 major chromosome testing will be sufficient. Alternatively, we can also use next generation sequencing to screen all 23 sets of chromosomes. So if you would like to screen all of your chromosomes as opposed to only 5 of them, then next generation sequencing can also be an option. Now in this case, with the case of next generation sequencing, we usually recommend it to patients who do have an increased background risk of certain genetic disorders, or patients who've gone through IVF cycles and have many failed IVF cycles, patients who are at an elevated risk of having certain genetic disorders, or recurrent miscarriages, for example. If the couple has gone through a number of miscarriages without a possible explanation, and the risk of the baby having certain genetic disorders is higher, so next generation sequencing can actually offer you certain benefits in that respect. Otherwise, if there are no elevated background risks of genetic diseases, then the NGS may not be necessary. The 5-chromosome testing is usually sufficient for you. Now, as I've mentioned this, PGD can only be done as part of an IVF cycle because it requires us to obtain a biopsy sample from each and every single embryo. For us to be able to have access to the embryos, we should create them inside the laboratory environment. So it cannot be offered as part of an IUI cycle because an IUI cycle doesn't let us create the embryos. So IVF with PGD, in terms of the procedure, comparing this to Microsort IUI or Microsort IVF, just like Microsort IVF, when you're going through IVF with PGD, the female patient is going to be prepared with a medication regimen in the expectation that we can maximize the number of oocytes as well as the quality of oocytes. So we want as many eggs as possible so that we can get as many embryos as possible, because in the end we will want to biopsy these embryos and be able to see the sex, be able to select the ones that have no genetic abnormalities. So we want to have as many embryos as possible so that we can get as many viable embryos as possible in the end. So just like a regular IVF cycle, we administer a certain medication protocol, and then what we do is we screen the follicular growth, we screen the follicles. Once the follicles reach a certain size, we administer the trigger injection, and after about 35-36 hours, we proceed with collecting these oocytes, collecting these eggs that have developed. And then we use the male partner's sperm sample to fertilize these eggs. Now, at this point, you can also combine IVF PGD with Microsort as well. So you can use a sorted sample from the male patient and fertilize the eggs with the sorted sample so that we can increase the odds of having embryos of desired sex. So this gives you the benefit of both worlds. With using Microsort, you can actually increase the chances of having embryos of desired sex. And then once you go through the PGD testing, then you can go ahead and actually have an accurate gender selection process. But when you combine both of them, it just gives you a higher chance that you'll have as many embryos as possible that are of desired sex and that have no major genetic abnormalities. Then again, embryos are incubated for about 5 days, and once they reach the blastocyst stage, they will be selected for embryo transfer. Excuse me 1 second, I want to turn this down because I am receiving a lot of messages and the beeping sound is kind of disturbing me right now. Okay. All right. So moving on, as I've mentioned this before, with PGD, when you incubate the embryos into the blastocyst stage, what you do is you take a tiny biopsy sample from each and every embryo at this blastocyst stage without disturbing embryo growth or development. This is a question that we get quite often. When we take a biopsy sample from the embryo already has many cells at this stage. So taking one little cell will not affect the embryo's growth or development potential. And once you take the biopsy, depending on which test you're going to run for genetic testing, depending on which test you would like for gender selection, NGS or the 5 chromosome testing, the process will be short or long depending. If you go for the 5 chromosome testing, once we take the biopsy samples in the morning, it usually takes us about 6 or 7 hours to come up with the results. And usually the embryo transfer can be scheduled in the afternoon after we have the results of the testing. If you opt for NGS, the next generation sequencing, where all of the chromosomes have to be screened, obviously this will take a longer period of time. And usually the embryo transfer takes place the next day. And once the testing is complete, we go ahead and select the viable embryos for transfer. And then depending on how many embryos you would like transfer, we can transfer 1 embryo, 2 embryos, or 3 embryos. 3 embryo is the maximum number of embryos that we can transfer, and depending on the viability, depending on the quality of these embryos, that's a decision that you will get to make on the day of your embryo transfer. So we will be able to discuss in terms of chances of success, in terms of the risk of a twin or a triplet pregnancy. We will be able to give you all the facts so that you can make an informed decision. In terms of chances of success with IVF and PGD, we're looking at, again, just as in Microsort IVF, we're looking at about 70 to 75% chance of success in younger age brackets. This does go down as the age of the female patient goes down. So if you're in your 40s, mid 40s, then you're not going to have this level of success with IVF, with PGD. This will probably be in 20-25% bracket. In terms of accuracy of selecting the sex of the embryos, this will give you about 99.9%. It's actually very close to 100%, but in medicine we never quote 100% success, 100% accuracy. There's always a room for error. So we quote 99.9% regardless of the sex selected. So for female or male selection with PGD, there's no difference whatsoever. So both sexes can be selected with almost 100% of accuracy. In terms of the 5 chromosome testing, the cost of treatment is 5,000 euros. If you would like to opt for NGS, which is screening of all of the embryos, then the baseline cost is 4,000 euros plus 350 euros per chromosome. So if you have, say, 10 embryos, I said per chromosome on the slide, but that's per embryo. So if you have 10 embryos, that would drive up your cost to 7,500 euros, for instance. If you would like the 5 chromosome testing with PGD as well as Microsort, so you want to get the best of both worlds, then your total cost would be 6,200 euros. Okay, so how do you get started? The initial stage before you can plan a treatment cycle is testing. Even though we do get this question a lot from patients who already have children, who have no problems conceiving naturally, testing is a necessary part of planning. Because regardless of whether you have a problem with fertility or not, we do want to see the level of your ovarian activity. We do want to see the sperm parameters, because when we have the hormone profile of the female patient, then we get to see what her fertility range is, so that a medication protocol can be administered accordingly. Because the purpose of medication is to maximize the amount of eggs and the quality of eggs that we can get from the female patient. So if we administer medication blindly, we may end up overstimulating the patient, or we may end up getting too few eggs. So we need to know exactly what the level of fertility is, so that we can maximize the number of eggs that we are able to get. So for the female patient, what we're going to be asking for is a baseline pelvic ultrasound scan. The ultrasound scan will help us see if there are any ovarian or uterine pathologies. These pathologies can sometimes interfere with a pregnancy, so we want to make sure that there are no visible pathologies. And also, it helps us see how many antral follicles there are in each ovary. Also, on the very same day, so this is done on day 2 or day 3 of the menstrual period, so that we can establish a baseline level or a baseline value. So apart from antral follicle testing on day 2 or 3, we also want to see the patient's hormone test results. These hormone tests are FSH, LH, AMH, prolactin, estradiol, and we also want to see the thyroid stimulating hormone level, because thyroid levels are also associated with in terms of the quality of your oocytes. So your thyroid levels, hypo or hyperthyroidism, can also influence how well you're ovulating. So this is something that we also want to see. So FSH, LH, AMH, prolactin, estradiol hormones on day 2 or 3 of the menstrual period will give us substantial information about your ovulation potential. So for the male patient, we will want to see a semen analysis. Again, even if the patient has fathered a child before, we still need the semen analysis, especially if the patient is requesting Microsort. Microsort necessitates the semen parameters to have certain levels. For example, for Microsort to be able to perform, we want the semen sample to have a certain level of concentration and motility. So if the semen sample lacks this, it will still allow the male patient to have a natural pregnancy, but it will not allow us to be able to effectively perform sort. So having fathered the child previously doesn't necessarily mean that the semen sample is good enough for Microsort. So we want a semen analysis to make sure that it complies with the Microsort requirements, and also it complies with ICSI requirements. In some cases, we may want to administer certain medication or some other precautionary measures so that we can effectively select the best sperm samples. So let's talk about the timeline of treatment. We've touched up on the timeline a little bit throughout the presentation, but I want to go over the timeline that you would be looking at when you're getting ready for your treatment with us. The first part of getting ready for the treatment is the initial testing that we just discussed. Male and female testing would be the first stage of preparation for your IVF cycle, because we want to be able to see your test results. We want to be able to establish a baseline level for your ovarian activity, and then we can design a suitable protocol for your treatment. So once we design this protocol, we will be able to issue your treatment calendar and your prescription so that you can obtain your medication locally at your local pharmacist, or you can use one of our international pharmacies that we work with, so they can send you the medication. In terms of your initial treatment, once you get your treatment calendar and prescription, you have two options. You can start using your medication and you can do your initial screening locally in your home country under our supervision, obviously. So we would be able to monitor you remotely based on your treatment calendar, because your treatment calendar will be custom prepared for you based on your hormone levels, based on your ultrasound scan, based on the semen parameters. So you will be using a medication protocol that is customized for you. But once you start using this medication protocol, we will still want to monitor you. We will still want to see how the follicles are responding to the medication, how the follicles are developing in a timeline. So the two options that you have is you can either start using medication locally and go to your local clinic or testing center so that we can screen the follicular development. Alternatively, you can come to Cyprus for the entire treatment, so you don't need to organize anything locally. You don't need to obtain the medication locally. And the testing and the scans and the medication in Cyprus would be much cheaper compared to the UK or the US or other parts of Europe. So that would give you a lot of benefits financially. But if you are to stay here in Cyprus for the entire treatment, then you're looking at about 3 weeks. So if you do have 3 weeks to spare, if you have the flexibility in terms of time, then we do recommend coming to Cyprus for the entire treatment so that we can monitor everything from start to finish here. If you don't have that much of a time to travel, and if you're only looking at about 7-8 days of flexibility, then you would need to start using your medication locally. And depending on your location, we may be able to recommend you certain testing centers and certain scan centers so that you can do the initial testing and screening locally. So with the local treatment, when you start using the medication locally, what happens is you start using medication, we ask for a couple of ultrasound scans, and then we decide on when the trigger injection needs to be administered, and then you organize your trip to Cyprus. And once you arrive in Cyprus, we give you a final scan. We time the trigger injection, and then we plan your oocyte retrieval and the rest of the procedures accordingly. In this case, if you start your initial treatment locally and come to Cyprus to finalize the treatment, then you're looking at about 7-8 days or 9 days maximum for your length of stay in Cyprus. So this is pretty much it, and this is our core team especially if you're going for gender selection treatment. These are the people who are going to be involved with your treatment, and the rest of the team are going to be there to support you. So thank you very much, and you can always reach us on our emails, on our phones, if you have any further questions.